Hi everyone. So today we will be discussing the very important topic of the blood banking, that is a blood donor criteria. Okay. Whenever a donor comes to a blood bank, they have so many questions like whether they are eligible for the donation or not. If they are not, then how long they cannot donate the blood. So all that question will be there in this criteria. Okay, let's begin. So there are three types of deferral. Number one is the temporary. That means that the donor is unable to donate for the limited period of time. Second is indefinite. That means that the donor is unable to donate blood for someone else for an unspecified period of time due to currently regulatory requirement, but can donate when the requirement change and he or she is eligible for the autologous blood donation. And the third one is a permanent deferral. That means that the donor will never be eligible to donate blood for someone else, like the patient who are having the cardiac disease or the patient who are having viral positive HBS, HIV. So these type of patient cannot donate. So permanent defer. Okay. So the donor selection criteria, it depends on like first when the donor comes to the blood bank. So we'll start with the registration, then medical history, health checkup, and then in the end we have to take that consent. The registration includes the name, date and time of the donation, address of the donor, telephone number, gender, and type of donation, whether the donor is voluntary or replacement. Next is the medical history and checkup. So here the pre-donation information should include, and we have to explain donor about the transmission of the infectious agent and give them the chance for the self exclusion, which is also known as the CUE, like confidential unit exclusion for the patient safety. Then we have to tell what are the tests that are carried on that blood which they are donating and the confidentiality of the test result, and we expect that the donor give the honest review of the window period. Now, what are the criteria? First is the well being of the donor. So, donor shall be in a good health, mentally alert, physically fit, shall not be the inmate of the jail or any other confinement. Differently abled person can donate provided that clear and confidential information can be given by the donor. Age minimum is 18, maximum is 65. For the first time donor, the age should not be more than 60 years. For apheresis, 18 to 60 years. For whole blood volume to be collected and the weight of the donor is according to, like, if the weight of the donor is 45, then you can go with the 350 ml of blood collection. If it's more than 50, then 450 ml. For apheresis, the weight requirement is 50 kg. Interval. When a donor is donating the whole blood, then for male donors, every 3 months they can donate. For the female, every 120 days after they can donate. For apheresis, at least 48-hour interval after the platelet and plasma apheresis shall be kept. After whole blood donation to a platelet pheresis donation cannot be accepted before 28 days. After apheresis, whole blood donation can be accepted after 28 days from the last donation. After apheresis, whole blood donation after 90 days if the red cell reinfusion was not complete. A donor shall not donate any type of donation within 12 months after a bone marrow harvest. A donor shall not donate any type of donation within 6 months of peripheral stem cell harvest. Then the blood pressure, the systolic should be between 100 to 140 mmHg. Diastolic is 60 to 90 with or without medication. There is no finding suggestive of the end organ damage or the secondary complication. No history of giddiness and fainting. Neither the drug nor its dosage should be altered in the last 28 days. Pulse should be 60 to 100 and it should be regular pulse. The donor should be afebrile and maintain the normal body temperature. Then respiration, donor shall be free from the acute respiratory disease. Hemoglobin should be more than 12.5 gram by dl. Thalassemia trait may be accepted provided the hemoglobin is in the acceptable range. The donor should not be a night shift worker and the donor should have proper sleep, 6 to 8 hours sleep before donation. Air crew member, long distance vehicle driver, or person who are engaged in the uh, strenuous work should not donate blood for 24 hours prior to their next shift. Then donor should not be fasting before the blood donation. The last meal should be 4 hours prior to the donation and the donor shall not consume alcohol or show sign of intoxication before the donation. Donor shall not be the person with the regular heavy alcohol intake. Risk behavior, donor shall be free from any diseases, especially from the TTIs. Donor shall not be at the risk of HIV, hepatitis C and B infections. Then about the travel and their resident, donor shall not be a person with a history of resident or travel in a geographical area which is endemic for the diseases which is transmitted by the blood. Donor skin should be free from the diseases from in the phlebotomy site, arms, forearm free from the skin puncture, scars indicative of professional blood donors, self-injected narcotics, so that professional the donor should be prohibited. So do regularly check the donors. Then physiological status for the women. If the woman is pregnant or recently delivered, then defer for 12 months after delivery. In case of abortion, defer for 6 months after abortion. Breastfeeding, defer for the total period of lactation. Menstruation, defer for the period of menstruation. For blood donation and respiratory disease, non-specific symptoms including pain, malaise, headache. So defer until all the symptoms subside. For cough, flu, sore throat, acute sinusitis, defer until all the symptoms subside and donor is afebrile. Chronic sinusitis, you can accept that donor unless the donor is on antibiotic. Asthmatic attack or asthmatic on steroid, these are permanently defer. In case of major surgery, you can defer for 12 months. Minor surgery, 6 months defer. If a donor received the blood transfusion, 12 months defer. In case of open heart surgery, including bypass surgery, cancer surgery, permanently defer. In case of tooth extraction or dental surgery under anesthesia, defer for 6 months. In cardiovascular disease, if the donor is having any active symptoms like chest pain, shortness of breath, swelling of feet, then permanently defer. If the donor has MI, cardiac is on cardiac medication, hypertensive heart disease, CAD, angina pectoris, rheumatic heart disease, then permanently defer that donor. In case of migraine, except if it is not severe and occur at a frequency of less than once a week, convulsion, epilepsy, schizophrenia, permanently defer. Anxiety and mood disorder donors, you can accept the person having anxiety and mood disorders like depression, bipolar, but that donor should be stable and feeling well on the day, regardless of the medication. In case of diabetes mellitus, you can accept the diabetic donor if their diabetes is well controlled and they are on oral hypoglycemic medication with no history of orthostatic hypotension, infection, neuropathy, or vascular disease. But if the donor requires the insulin or is having complication of diabetes with multi-organ involvement, then you have to permanently defer. You will also defer the donor if the oral hypoglycemic medication has been altered, dosage has been adjusted in the past 4 weeks. For thyroid disorder, except the benign thyroid disorder if it's a euthyroid, and defer if the thyroid is under investigation for the thyroid diseases and the thyroid status is not known. You can permanently defer if the donor is having thyrotoxicosis due to Graves' disease, hyperthyroidism, and there's a history of malignant thyroid tumor. For other endocrine disorder, you have to permanently defer that donor. For liver diseases like hepatitis, if there is a known hepatitis B and C or unknown hepatitis, you have to permanently defer. In case of hepatitis A and E, defer for 12 months. If the spouse, partner, or close contact with the individual who is suffering from the hepatitis, then the deferral period is of 12 months. If a donor is at risk of hepatitis by tattoos, acupuncture, body piercing, other things, then defer for the 12 months. Spouse or partner of individual receiving transfusion of blood and components, defer for 12 months. Jaundice, except the donor with the history of jaundice that was attributed to gallstones, Rh disease, mononucleosis, or in neonatal period. Chronic liver disease and liver failure donors are permanently defer. For HIV and AIDS, so at risk of HIV infections, permanently defer. Known HIV positive patient or spouse or partner of people living with the HIV/AIDS, permanently defer. Person having symptom which is suggestive of AIDS, then permanently defer that person. Having the lymphadenopathy, prolonged and repeated fever, prolonged and repeated diarrhea, irrespective of HIV status or risk. Syphilis and gonorrhea, permanently defer. So history of measles, mumps and chickenpox, defer for 2 weeks following the full recovery. Malaria, defer period is 3 months following full recovery. Typhoid, 12 months defer period following full recovery. Dengue and chikungunya, so in case of dengue and chikungunya, defer period is of 6 months following full recovery. Following visit to dengue or chikungunya endemic area, then 4 weeks is the deferral period. Following the return from the visit to the dengue endemic area if no febrile illness is noted. In case of Zika infection, defer period is 4 months following recovery. In case of history of travel to West Nile virus endemic area or Zika virus outbreak zone, the defer period is of 4 months. For tuberculosis, defer period is 2 years. In case of leprosy and leishmaniasis, the donor is permanently deferred. So in case of conjunctivitis, defer period is for till the illness and the continuation of the local medication. Osteomyelitis, defer period is of 2 years following completion of treatment and cure. Acute infection of kidney like pyelonephritis, 6-month defer period after complete recovery and the last dose of medication. In case of UTI cystitis, 2 weeks is the defer period following the complete recovery from the last dose of medication. Chronic infection of kidney disease, renal failure, permanently defer that donor. Diarrhea, person having history of diarrhea in preceding week, particularly if associated with the fever, defer for 2 weeks after complete recovery and the last dose of medication. GI endoscopy, defer for 12 months. Acid peptic disease, except the person with the acid reflux, mild gastroesophageal reflux disorder, hiatus hernia, but permanently defer the donor if the donor is having stomach ulcer with symptoms or with recurrent bleeding. So next comes your polycythemia vera, autoimmune disorders like SLE, scleroderma, severe RA, bleeding disorder, unexplained bleeding tendency, malignancy, severe allergic disorder, hemoglobinopathy with red cell enzyme deficiency with known history of hemolysis. You have to permanently defer the donor. For vaccination and the drugs, non-live vaccines and toxoid like typhoid, cholera, pneumococcal vaccines, polio injectable vaccines, tetanus, diphtheria defer for the 14 days. For live attenuated vaccines like polio, measles, mumps, yellow fever, hepatitis A defer for 28 days. anti-tetanus serum, anti-venom serum, anti-diphtheria, anti-gas gangrene serum. 28 days is a defer period. Anti-rabies vaccination following animal bite, hepatitis B, immunoglobulin, then defer period is of 1 year. If the donor is on the contraceptives, oral contraceptive, you can accept that donor. If the donor is taking the analgesic, vitamins, or has taken mild sedative, or if the donor is on allopurinol or the cholesterol lowering medication, you can accept that donor. For the donors who are on antiplatelet drugs like aspirin or NSAIDs, so defer that donor for 3 days if blood to be used for the platelet preparation. If the donor is taking ketoconazole, antihelminthic drugs, then defer the donor for 7 days from the last dose if the donor is well. If the donor is on any kind of antibiotic, then you can defer the donor for the 2 weeks after the last dose if the donor is well. So if the donor is taking the clopidogrel, then defer for 2 weeks from the last dose. If the donor is taking isotretinoic acid, defer for 1 month. If the donor has used radioactive contrast material, 8-week deferral period, or any medication of unknown nature, then defer till the details are available. If the donor is on insulin, permanently defer antiarrhythmic, anticonvulsion, anticoagulant, antithyroid drugs. You have to permanently defer that donor. If the donor is a recipient of organ stem cell tissue transplant, then you have to permanently defer that donor. Then last part is the consent part. So the blood donation is a totally voluntary act and no inducement or the remuneration has been offered. Donation of the blood and the component is a medical procedure and that by donating voluntary. So the donor has to give such type of a consent that he or she is agree for the testing which is to be done on their blood, and they are doing it free of will without taking any benefits from the party. Thank you so much. Please like, share and subscribe my channel.